Hi everyone, I'm Melissa Carey, and this is my evidence-based practice presentation on nursing staff impact on patient outcomes. The purpose of this presentation is to determine if there is an impact on patient outcomes, which can include falls, medication errors, or increase in patient mortality with having a decrease in nursing staff. Nursing staff broadly includes nursing turnover, level of staff, and retention. The PICO question is, in patients in an inpatient hospital setting, does a decrease in nursing staff in comparison to an increase in nursing staff impact patient outcomes? To select the appropriate articles, relevance to the PICO question was a priority, and those articles were selected by reading the abstracts to determine the validity and reliability. I did use the cumulative index for nursing and allied health along with PubMed, using keywords such as nursing retention and patient outcomes. These were then narrowed down to terms such as nurse staffing or retention or turnover and patient outcomes or adverse events to generate over 97,000 articles. I then used features on the left to narrow the search for the last 10 years, academic journals, English language, and include patient safety and subject headings. I also used best matches in the PubMed tab to narrow the search to the same criteria. The first article uses secondary analysis to examine how turnover on nursing units affect learning processes and the results of patient outcomes. The second article uses a multitude of methods, including cross-sectional, observational, and retrospective research to study 4 different variables that correlated with increased mortality in the hospital setting. The third article uses systemic review and meta-analysis, a method of study. It was included because it provided over 96 articles that directly related to the PICO question in the increase and decrease of nursing staffing ratios, its effect on patient outcomes, including but not limited to respiratory failure, falls, infection, shock, and mortality. The fourth article focused on patient mortality rates in relation to a decrease or increase in nursing staff. This article was selected based on a direct relationship of the PICO question, relatively large sample size, and recent publication within the last 10 years. The last article is a cross-sectional study, was selected due to the most recent publication. Again, the large sample size and direct relevance to the PICO question. This article revealed that inadequate nursing staff directly relates to adverse events in hospitalized patients. Article overview. So the first article's purpose was to examine how turnover on nursing units affect learning processes and the patient outcomes. Results included nursing turnover impacted work group learning, which therefore impacted patient outcomes related to falls and medication errors. Work group learning was found to be the most significant when linked with the medication errors. And patient falls were likely to decrease by 24% when nursing units had turnover rates between 0 and 3.3%. The next article's purpose was to, they studied 4 different variables: nursing ratios, experience level, bachelor's degree, and total nursing staff, to establish if there is a correlation with increased mortality in a hospital setting. Results included over 2,500 patients admitted to different hospitals and units in Thailand with a variety of medical conditions. The higher the Apache 3 score, the higher the mortality risk the patient had. The study concluded that there is a direct association with nurse-to-patient ratios and the risk for patient mortality. The third article's purpose was to determine if staffing levels of nurses directly related to the outcomes of hospitalized patients. The results concluded mortality in ICUs, surgical units, and medical units. 1.2% reduction in patient mortality when increasing just 1 nurse per patient day. The lower patient adverse effects included pneumonia 19%, respiratory failure 60%, cardiac arrest 28%, and unexplained extubation 51% was also shown to have a correlation with increasing 1 nurse per patient day. The fourth article's purpose was to examine the relationship between nursing staff and patient mortality. The results showed decreased care, higher risk for serious events, and increased mortality when having less staff to care for a higher acuity of patients. To determine the relationship between staffing, high turnover, and patient mortality, a hazard ratio was used and showed that high nursing staff turnover was associated with an increased risk of mortality or death. The last article's purpose was to study the relationship of staffing and patient adverse events, including wrong medication or dosage administration, patient falls with injury, and pressure injuries. 96% of nurses revealed an increase in medication errors. Falls and pressure injuries occurred when nurse-to-patient ratios were too high in each shift, and you can see the results in each section. The 5 articles chosen all study and show a direct relationship between nurse staffing levels and patient outcomes. However, some articles study specific patient adverse effects, such as medication errors, falls, or injuries, in Cho's article, in comparison to patients' likelihood of developing pneumonia, respiratory failure, cardiac arrest, or even unexplained extubation, in Kane's article in 2007. In these 2 articles, they each reveal that the higher nurse-to-patient ratios reduce the overall risk of patient adverse effects. And then there was another article that, although they did look at patient falls and medication errors, they also looked at higher staffing turnover and how it negatively impacts work group learning. So the more work group learning that was performed in nursing units, the less likely errors were to occur. The last 2 articles focus on patient mortality, and then the 4 variables were included in one of the articles: nursing ratios, experience level, bachelor degrees, and total nursing staff were examined to establish if there was a correlation with increased mortality in hospital setting. Where the other article, although still looked at mortality, focused more on the relationship between hospitals with magnet designation, higher staffing numbers, and lower mortality rates. Nurse-to-patient ratios and experience level was also looked at in medical and surgical units in comparison to turnover rates of nursing staff, and not nurse-to-patient ratios. Although the articles studied similar but different variables, they all supported the PICO question and all revealed that decreased nursing staff or increased turnover impacts patient outcomes. Overall, the 5 articles support the relationship between nursing staff and patient outcomes. In each article is showed with a decrease in nurse-to-patient ratios, there is a direct correlation in increased patient adverse effects or mortality. Increasing the level of nursing staff per patient day revealed a decrease in falls, medication errors, risk for patient mortality, and overall less adverse effects. The 5 articles, again, all supported the PICO question, but providing substantial evidence of the importance of adequate staffing per patient in hospitalized units to provide exceptional care. So the obvious recommendation is to increase nursing staff to reduce overall nurse-to-patient ratios, help increase work group cohesion, implement policies to ensure proper staffing levels and improve work environments, and retain experienced nurses and reduce nursing turnover rates to improve overall quality of patient care. In conclusion, the 5 articles do support the PICO question and show evidence that a decrease in nurse-to-patient ratios has a negative impact on patient adverse effects and patient mortality. Overall, the research implies that increasing nursing staff, retaining nurses, improving turnover rates, and increasing work group learning will all have positive impact on overall care and outcomes of hospitalized patients. Here's my reference list. And we nurses do make a difference, so thank you for listening, and I hope you have a great day.